Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Radiosensitive and the radioresistant bone tumors. So first let's look at the RS, that is the radiosensitive. So here it includes the metastasis. So there is metastasis. So by metastasis, except the metastasis from the RCC. So except the metastasis from the RCC, as renal cell carcinoma, and this is considered to be RR, that is a radio resistant. Next, what do we have? Next is there is Ewing sarcoma. There is Ewing sarcoma, as well as there is multiple myeloma. All these are radiosensitive, as well as the lymphoma. All this becomes radiosensitive. Then we look at the RR, that is a radioresistive. So radioresistive, there is presence of the osteosarcoma, and there is also presence of the chondrosarcoma. So osteosarcoma, chondrosarcoma. Then comes the fibrosarcoma. So osteosarcoma, chondrosarcoma, and the fibrosarcoma. And then comes the malignant fibrous histiocytoma. So there is malignant fibrous histiocytoma. To learn and grow daily like this, please do subscribe.